This is Grace with Graceful Living. Today we have a special episode with Dr. Terrence Young DDS, who is a local dentist in Honolulu. He is going to talk about cavities and how to prevent them.
Cavity is a bacterial infection within the tooth. Say this picture right here, this is a bacterial infection which is eating its way through the tooth. The best way to prevent cavities is to brush regularly. Of course, see your dentist at least twice a year for professional cleanings, flossing, and using a good toothpaste. The whole process of brushing your teeth is to remove the biofilm layer which surrounds the tooth, and we know it also as plaque, that sticky, squishy white plaque that accumulates on our teeth. And so even a plain toothbrush with just water will remove that. A lot of the other toothpaste components support other ideas, plus it provides a fresh taste. A simple brush of water and a rinse of water and flossing probably is as effective as most toothpaste, I would say. The ideal, perfect scenario would be to brush after every meal, but that may not be realistic in many cases for people. So I would highly recommend in the morning and before you go to sleep. Those two times definitely. And if you can, catch it after lunch.
So if you brush in the morning, should you brush right when you wake up or after you eat?
I would brush after you eat, because that way you won't have debris in your mouth for many hours before your next brushing.
How often should someone floss each day?
I think the best is at least once a day. And my recommendation to my patients is generally at night before you go to sleep. During those times, there's less saliva flow in the mouth. You don't want bacteria to be sitting for too long in one spot, because then it starts to begin the cavity-causing process of demineralization.
So what if someone does not ever floss? Have you seen people who have never flossed and had good teeth before, or does that ever happen?
It's rare. It's very rare to find someone like that. If you don't floss, a couple things occur. You're trying to break the surface area between the teeth. Between the teeth, there's a microscopic layer, a biofilm layer, which if you leave it undisturbed, that's what will cause a cavity occurring between your teeth. And that's one of the most common areas for a cavity, is between the teeth. Also, if the plaque is left around the tooth, in between the teeth, that's also a spot where gum disease likes to begin. Gingivitis is inflammation of the gum tissue, which leads to periodontitis, which is loss of bone, and all attributable to not enough flossing.